Hello and good afternoon. My name is James Brent, and I have the pleasure of being the chairman of the Royal Devon and Exeter and Northern Devon Healthcare Trust. The purpose of this presentation is that during this period of COVID-19, we have decided that it would be unsafe, clearly, given the lockdown and the social distancing arrangements, for us to have board meetings physically in public, and it's a challenge to get engagement from our governors and public. So what we've agreed to do is that after each board meeting is that I'd give a brief summary of what happened at the board meeting, and then ask one of my non-executive colleagues to provide some further update to our governors and the public. So I've just come out of a 3-hour board meeting. It was jointly held between Northern Devon Board and Royal Devon and Exeter, and then that was for the first part, and then for the second part was just the Royal Devon and Exeter, and we have a Northern Devon Healthcare Trust Board meeting next week. So just running through what we discussed at the board, the first item on the agenda, after we dealt with apologies and declarations of interest, of which there were none, was to talk about COVID-19 and an update on where both of the trusts were. It's been very positive news in Devon. Sadly, we have experienced a number of deaths of patients with COVID-19, but in percentage terms and in absolute terms, we've been much less significantly hit than other parts of the country and indeed of Europe. So it was a very reassuring feedback from our colleagues, from our executive team, our chief executive, and her colleagues, explaining where we were both with COVID-19 and in terms of the other really important services that we're focused on. So there was quite a lot of discussion and debate about how we make sure that we are prioritizing, as well as COVID-19 patients, patients with other life-threatening and time-critical disease. And as we come through this current challenge, how we also recover the position for our elective patients. So very, very good debate. The next substantive point on the agenda was talking about the Joint Ethics Committee, which we have formed. Now, we're very keen to be transparent on how that Ethics Committee will operate. It's a committee that will report directly to the board, and that will be set within the wider governance arrangements that we've established. So we debated, first of all, the wider governance arrangements. What we've decided to do is that during this period of COVID-19 challenge, it's really important that the primary focus of the organisation remains on our patients, as it always is, but that in particular during this period, that we focus on the changes that are necessary within the trust and outside the trust to ensure that we look after all of our patients, as both COVID-19 patients, but also in the short term, patients that have life-threatening or time-critical illnesses, that we have very strong focus on them and looking after them. And so what we've decided to do is to abbreviate our governance arrangements over this period, to simplify them. That doesn't mean the governance is any less important. It just means we need to find out ways of spending less time on it. So we had a really good debate. The governance structure has been materially simplified. So we have the board of directors clearly sitting at the top, being held to account by the council of governors, and then under the board of directors, just 3 committees: the audit committee of each of the organisations, the governance committees of each organisation, and then a joint ethics committee. So those revised arrangements were agreed, and it was agreed that we'd review them in 3 months' time. The next item on the agenda was going into more detail about the ethics committee, which is a new committee that's been set up. It's been set up to cover both the organisations, both NDHT and the Royal Devon and Exeter, and it will also cover the new Nightingale Hospital on the basis that that is expected to be hosted by the Royal Devon Exeter. The Ethics Committee is being set up to ensure that there is fairness in terms of the way in which we engage with our patients, that there's consistency, a logical approach, and that there is ownership by the board of the ethical decisions which need to be taken. The board both unanimously again approved the new ethics committee terms of reference, and those terms of reference will be published. The next item on the agenda was the new Nightingale Hospital for Devon and Cornwall. This has been well written up. As I mentioned, we're very proud as an organisation, as the Royal Devon Exeter, that we have been asked by NHS England to host that new arrangement and to provide governance for it. We had heads of terms were presented to the meeting for the new facility, which is now to be located at the old home-based store in Soughton and in Exeter, and those heads of terms were approved by the board. The next item on the agenda was a change to our constitution. It was a fairly small change, but an important one. So we have governors' elections that are scheduled to take place in September of this year, and it clearly would not be safe for us to hold those elections given the social distancing requirements related to COVID. So what we have agreed to do, and the Council of Governors had already approved this, but it requires approval of both the Council of Governors and the Board of Directors, was that we agreed that those governors whose terms of office come to an end in September 2020 will automatically have their terms of office extended for a further year to September 2021. The next item on the agenda, again, this was just for the RD&E board, was the Integrated Performance Report. The Integrated Performance Report looks at the performance of the organisation across all of the different categories, looking at the access to our services, looking at the quality and safety of them, look at the financial performance. The IPR, the Integrated Performance Report, will be published on our internet website and will be available for you to see. There was a strong interrogation of the report, and that was noted. Next on the agenda was reports back from the Audit Committee and the Governance Committee of the Royal Devon Exeter, together with updated terms of reference for the Audit Committee. Those reports were noted and the terms of reference were approved. The final thing on the agenda was the Q4 finance and workforce returns that we are required to make to NHS England. Again, those were reviewed, including the final financial position for the Trust, for the Royal Devon and Exeter, for the year ended 31st of March 2020, and the report to NHS England was noted and its contents and recommendations were ratified. The meeting was then brought to an end. So as I mentioned from the outset, the intention is for a short period of time while we have this challenge is to hold the board meetings rather than to have public and private board meetings we normally do, is just to have board meetings virtually that will be private. But again, I will record a video after each of those meetings just explaining what was discussed, and I will ask one of my colleagues from each of the two trusts, Royal Devon and Exeter and Northern Devon Healthcare Trust, to report on them. The next board meeting for Northern Devon Healthcare Trust is next week, and the Integrated Performance Report and an update from me will follow that meeting. Thank you very much again for listening, and please keep safe.
I'm very pleased to have this opportunity to contribute to this video. And I'm sorry that I'm not live, but we had technical problems with that. Just to set the scene, my name is Tim Douglas Riley. I'm one of the 5 non-executive directors on the board of North Devon Healthcare Trust, in addition to James Brent, the chairman. And I therefore represent the North Devon element of this joint board in this particular transmission. Firstly, I would like to take the opportunity to highlight the staggering amount of preparation, planning and delivery that has taken place to meet the huge and certainly novel threat of COVID-19. Every single NHS employee at every level and all those working for our supporting partners have stepped up in the most fantastic, courageous and dedicated way, and we're truly blessed to have such people caring for us all, and we owe them a great debt of gratitude. I'd like to assure everyone that all this planning, in all this planning, the non-executives have been fully engaged, contributing to the debates and discussions and seeking answers to difficult questions when appropriate. The Chair, James Brent, has outlined the update the board received on COVID-19 and where we're at the moment. At the very outset of all this, we ensured that the patient and not the numbers remained at the centre of our thinking. Not just the COVID-19 patients, but those with the life-threatening or time-critical conditions as well. And now, as we move forward, we are focusing more on those on the waiting lists as well, and how we're going to deal with the backlog of work that is inevitably built up. Turning to our discussion on the Joint Ethics Committee, I am very pleased to see that we at North Devon and Royal Devon and Exeter are at the forefront of policy development in the UK. You may wonder why we need an ethics policy, or even why we did not have one before. Having witnessed the huge challenges experienced in Lombardy and Italy, when demand significantly outstripped supply, it was clear a policy was needed to cover such a situation if that ever arose in the UK. This is a situation the NHS had never experienced before, and thus it was right that we became prepared for all eventualities. The formulation of a Joint Ethics Committee will be there to give clinicians the support and guidance if and when they need it, and ensure that all situations are managed equitably throughout our trusts. To finish off, I'm certain that all the hard work going into managing this current crisis will ensure the best possible outcomes for the greatest number of patients, whether suffering from COVID-19 or other conditions. And I can assure you that the entire board and all the non-executive directors are completely focused on delivering the best possible care we can. Thank you very much.